Hello, everyone. Happy Friday. Dr. Amy Ostick here with Health and Healing Direct Primary Care.
Dr. Brian Ostick. Hello, Dr. Ostick.
Hello, Dr. Ostick.
Before we get started, we did get some feedback about our volumes.
Yes.
Specifically, my volume not
Yes.
coming through very well.
Yes.
Thanks, Mom. Appreciate the feedback.
Director.
And we are working on improving that. So hopefully with our new microphones
Yes.
and with me speaking a little bit louder, you'll
Yes.
be able to hear what
You
we
need to
are.
enunciate
I will work on that.
and really quiet down the Philly accent.
Got it.
Okay. We're going to hit it hard today. So we're going to do top 5 things that we know about COVID-19. And if you want to see these sort of in black and white, you can go to my blog, healthandhealingdpc.com or hhdpc.net. And under there, I publish my blog on the first of every month. And I made that public around this pandemic because of just the need for accurate information and good resources. We're here for you. Health and Healing Direct Primary Care in Woodland Hills. If you have any questions about this information, I'm also on Facebook at OstickMD. Please feel free to message me anytime about just health information in general. If you want to make an appointment to come chat about our practice and how direct primary care is amazing and wonderful and it has been a great service to our community, call us at 818-600-2426. Okay, so getting right into it.
Viral transmission.
Okay.
Tell us about how this virus spreads.
Well, I'll tell you how it spreads and how it doesn't spread. There was a lot of concern in the beginning of the pandemic, especially because there was a novel coronavirus and we didn't want to make any assumptions until we knew more information and had more evidence out there about surface transmission and what we call fomite transmission, meaning, you touch a doorknob and then right after you touch that same doorknob, what is the likelihood of me contracting that virus if you were to have it? And it's really low. I mean, what we know about the novel coronavirus is even though there are some things that are new about it that make it more virulent and dangerous, the transmissibility is a very similar acting virus to other coronaviruses and other respiratory pathogens. It denatures as soon as it leaves its human host. So, within a half an hour after that doorknob, the person has to really cough violently in their hand, get those respiratory droplets on there, touch that doorknob. You need to come within that 30 minutes and touch that same doorknob and touch, an oral mucosal surface in your body. So without any of that happening, your risk of transmission through surfaces is very low.
Especially if you're washing your hands and trying to avoid
Right.
touching your face.
Right. And then what we also know is that whatever we're doing, we throw a mask on, it reduces the risk of not only giving it, but really probably getting it too, with some of the newer literature coming out as well about masking. So whether we like it or not, and I know it's difficult, but masking really reduces our ability to transmit the virus and contract the virus. Outdoor activities are also lower risk. Outdoor activities with kids, probably lower risk too, versus outdoor activities with a bunch of older adults. So again, that's kind of how this is transmitted. That 6-foot social distancing is very important too. These are heavy, dense respiratory droplets that are needed to transmit the virus. As soon as they leave, gravity just takes control and it can't make it beyond that 6-foot distance. So 6-foot distance is still pretty important as well.
All right. Well, tell us
Okay.
about the population that's affected. That's
Yeah.
number 2.
I mean, really sadly, this has hit our nursing homes tremendously, and over almost 60% here in LA County of our mortality has been those people in the nursing homes. And it's a lot to do with their vulnerable states for sure, but then they're also in closed, higher density homes with a lot of people coming in and out. And so that's been the really sad news. Now there's been a big push in LA County to really kind of mass test the caregivers and also the patients that are there so that they can control that transmissibility better, and then thus obviously a mortality rate. So nursing home patients, elderly population, but then the other population that's really been hit hard, especially in LA County, are our minority population. So a lot of Hispanics in LA County that live in lower socioeconomic circumstances. So whether they're in apartment buildings or higher dense populations, or there's a lot of families living in one home, whenever you have a higher dense living circumstance, you're more likely to transmit this virus. So this really points to our, psychosocial determinants of health. People that have poor access to primary care are doing worse with this disease because they're more likely to have uncontrolled diabetes, uncontrolled high blood pressure. Now they're getting coronavirus. Well, they're more likely to have a poor outcome. So it has really hit our minority populations really hard all over the world, especially here in LA County. So it's something that as physicians we have to be really attuned to, and making sure we're taking good histories when we see our patients for the first time and we're screening for novel coronavirus to see what sort of circumstances they are living in and what their access to primary care is like.
Good point.
So treatments, Dr. Ostick, what's working, what's not working?
Okay, hydroxychloroquine, which initially was the hot thing for coronavirus, is no longer. We are not using it anymore for our COVID patients in the hospital. It doesn't mean that hydroxychloroquine is out for good. There's a possibility that as we get more studies and more randomized controlled trials are done to look at it, that maybe there would be an effectiveness and we would bring it back as a treatment. But right now, hydroxychloroquine not recommended for treatment for COVID or for prophylaxis, even for healthcare providers.
Right.
Remdesivir, which is the newer medicine that has been used for coronavirus, has been shown to do some good. And we are usually using that in the hospital right now for treatment of severe COVID patients. It's not going to be used for somebody who I see in the emergency department and they have COVID and I send them home because they look well. It's not an at-home type treatment. This would be, you're really sick, you're in the hospital, we're worried about you. We're going to treat you with remdesivir. And the amount that we have right now is limited, and it's being kind of given out to each hospital based on their needs. We have enough for about 19 patients to treat at our hospital right now, but something that probably will continue to be used in the future for treatment of COVID. It does seem to have some effectiveness.
As the production starts to amp up too, hopefully.
Right.
Awesome. What about vaccines, Dr. Ostick?
Okay, so if we could get a vaccine against COVID, would probably be the best thing and the best news we could get in terms of getting past all this. Dr. Fauci, who is a very smart guy, very smart doctor, and has been involved with, I think, 6 different administrations. Presidential administrations. So he's been in this job for a long time. He kind of knows what he's doing. He says that we potentially have the ability to have a vaccine available by January 2021. And the reason we don't come out with these vaccines kind of right away is, one, we have to make sure they're safe. And for the most part, I think we get a pretty good job of making sure that they're safe. That's probably doable. But the more difficult thing is to say, we just need the time to show that it works. It doesn't do us any good if we give a vaccine today and show antibodies a week from now. We need to be able to show that there's antibodies 6 months from now or a year from now to make sure that those antibodies are staying inside the body to protect you from the COVID infection down the road. We want to make sure that we're not just having short-term antibodies and that there's no long-term antibodies from a vaccine. So that's really the important thing, and the reason it takes so long. We've talked about 12 to 18 months to get a vaccine in place.
And I thought it was interesting, he also mentioned it depends on where these vaccine trials are. So if they're in higher prevalent areas, we probably can show efficacy sooner than if we have a lower prevalent area. It's going to take a longer time for that person that's in that trial to be exposed to coronavirus and show protection. And then talk to me about the at-risk, the mass production of the vaccines.
Yeah, so I mean, we're mass producing these vaccines. Obviously, they're testing them. They'll be testing them in the populations from 18 years old to 55 years old. Just kind of that's where that's what they're doing in terms of trying to make sure that they're safe and the efficacy is there. But when a vaccine finally does come out, hopefully January 2021 or sooner. We would probably want to prioritize our healthcare workers first to make sure that they're safe, and then the high-risk populations after that. So your nursing home type patients, the patients that you mentioned that are at higher risk for having bad outcomes, those are the patients you would want to get the vaccine first.
Right.
And then we would try to roll it out to the whole population as that becomes available.
Right. And in typical vaccine trials, they'll show efficacy make sure it works, make sure it's safe, and then start mass producing. So then the production is probably delayed and distribution's delayed until you have enough doses.
Right.
And what these companies are doing is they're mass producing the vaccine while they're also showing efficacy. So like as soon as they know that it works,
Right.
it'll be go time for the vaccine distribution.
That's a good thing.
Yeah, which is a great thing.
All right, wrap it up. Health consequences of the pandemic.
Yeah, I think what we're seeing now as we start to go back into seeing regular, elective surgeries and seeing patients for regular visits other than coronavirus, we're, unfortunately, what we've seen is in some parts of the country a drop in well child visits, so a drop in vaccines, the schedule of vaccines. Which is not a good thing. The last thing we would want would be in a year from now to have a little mumps outbreak here, a little measles outbreak here, because people, our herd immunity kind of dropped just enough to have that outbreak. So I really encourage, I know it's scary to go to the pediatrician's office or the family doctor's office because of the concern of transmissibility, but there's definitely safe ways to do it. And so many offices are taking a lot of precautions, and certainly us here, we have one patient coming at a time, and there's really no interaction. We do home visits for vaccines. I mean, we can make it work. We just don't want kids to fall off their schedule.
Right.
So vaccines have, we've seen a drop in those. We certainly, would be hard to imagine a delay in diagnosis of cancers. That would be a really sad outcome from this. So if you're due for your colonoscopy, or if you're due for your mammogram and all of those things, get those done. That's not something we want to delay, again, because of a fear of transmission. These are life-saving interventions and preventions. So
we've seen a 50% drop off in visits to our emergency department.
Right.
And we're worried that patients are isolating at home even when they have a medical emergency. So if you're having a heart attack, don't stay at home. We can take care of you safely
Right.
in the ER. We will put you in the spot where you will not be at risk of
Right.
getting COVID.
And those are timely things. So heart attacks and strokes especially, hours, minutes really matter. So that's not a time to hem and haw about it and wait till the next day to see if it goes away. That's an ER call. That's a 911 call. That's a call to your doctor and getting to the ER right away so that you can get life-saving treatments.
We're recommending self-isolation, but not medical isolation.
Right.
If you need medical care, get it from your family doctor, get it from your emergency room doctor. Don't wait it out.
Right. That's right. Thank you so much, Dr. Ostick.
Thanks, Dr. Ostick.
Good job. Thank you here from Health and Healing Direct Primary Care. Call us if you have any more questions, 818-600-2426.
Wash your hands.